We have a special guest in studio with us this morning. If you have any pains in your body anywhere, this man can help you. Shannon's been talking about him on our Detroit station, Channel 955, during the commercial breaks, and now we get to have him in studio. I actually have been and probably will be a patient of yours because I've gone to you before when I've had pains. Dr. Cogan is in studio with us this morning.
Nerve Disc Institute.
Nerve Disc Institute. I actually went to you because I did have lower back problems, and I remember the first time. First off, you look great. You don't age at all.
Oh, I age.
No, you don't. You look fantastic.
You look fantastic.
No, seriously. I will tell you that if you're somebody that has dealt with any kind of pains in your life, the worst thing in the world, I'd rather have a headache that it is like migraine-ish than have my lower back hurt me.
Shooting back.
Because if the lower back or any kind of pains hurt you, you're inoperable, right? You can't do anything.
It consumes your life. I mean, it's awful.
And so Shannon's been talking about the Nerve Disc Institute and all this stuff. And I need to know about this whole thing. I need to know what you're doing and what's the whole game that's been happening here that's getting people back on their feet. I've got friends of mine that...
Without surgery.
That's crazy.
The crazy part is no surgery, no. I've watched my mom get injection after injection after injection after injection for her knees, and this is no injection, no surgery, no drugs.
I have golfing buddies that have gone to Dr. Cogan and literally they used to 4 holes in have to quit because they were hurting. Now they're finishing a round and beating my ass. But what is it that you got going on?
Well, it's interesting because traditionally, if you had a back problem or a severe knee problem, if you had degeneration, you really only had 3 options. One is to live with it. Here's the problem with living with those conditions is they're degenerative. They get worse with time. Second option is to manage it. A lot of ways to do it: anti-inflammatories, painkillers, physical therapy, chiropractic, acupuncture, massage, epidurals, lasers, or cortisone injection in the knees. Any and all these things can help you feel better, but they don't do anything to fix the problem. And then the third option, and the only correction option, was surgery. Here's the problem with surgery is, 1, it's a big deal.
Yeah.
And 2, especially in spine surgeries, they don't necessarily have great outcomes. They don't have great success rates. So we created a 4th option. And the Nerve and Disc Institute is really based around correcting problems. So instead of managing symptoms or trying to regenerate a little bit of tissue, we've come up with a system that does all these things and allows the body to heal itself, where we see pre and post changes on many of our patients. In other words, I'll have an MRI with someone that had a herniated disc, and 3 months later, it's gone. Or someone that's bone on the knee or near bone on bone, and we've created some space there, and then we give them tools to maintain that forever. Because my philosophy is real simple. After being with the Lions for 14 years and the Tigers for the past several years.
We need you back.
Man.
You're getting too injured.
They got a good medical staff.
They ain't you.
But at the end of the day, I didn't want to travel anymore. It's too much. But at the end of the day, I treat our patients like professional athletes, because if you just chase symptoms, it ultimately leads to surgery. And our systems, all of them, are designed to repair problems.
First off, Dom Raiola, speaking of the Lions, was one of the people that turned me on to you and to go to you because I had pain. I was coaching his son, Dylan, at the time. And so he said, you got to go see Dr. Cogan. And you and I kind of know each other over time. But tell everybody what it is involved in this. Is it a lot of appointments that you got to do? Is it an ongoing thing? Is it something where you magically all of a sudden go, boop, you're healed?
Well, here's the deal. Since it's not pain management, it's not a one and done. So there's typically multiple visits. And the number of visits can range from anywhere from 5 on the low end to 55. It really depends what the problem is.
But the pain's gone.
Yeah, well,
not even the pain's gone. You've repaired the problem.
Wow. Yeah.
And that's the key. So, it's easy to take something or get a shot for pain. It's harder to fix something. And most people that come to us, it took years. They've had a problem for years, and it took a long time to get there. So it does take some time to fix. But the idea is everything is designed to repair it. So there's a beginning, a middle, and an end, and then we'll give you some exercises to continue doing at home forever.
And it's wild. I had shoulder surgery this past year because I tore my. You don't even know.
Do you know how it happened?
He was drunk.
tell the good doctor how it
I
happened.
fell down the stairs drunk at Harper's in East Lansing. Okay? But it's
I thought
wild.
it was going to be a little more fun story.
But it's wild though because I feel like good, my shoulders are good, but occasionally, I get a little bit of the stiffness. I need to like figure out, where I want to get like I don't want to be. I'm not in total pain, but I want to like work it out a little bit.
So, it's funny that you brought that up because in December we opened a new division because it's called the Nerve and Disc Laser Institute.
Yeah.
Because normally out of every 10 people we see, I may accept 3 or 4. So 1 or 2 out of 10 aren't candidates, can't do it. 4 or 5 out of 10 who are technically safe to treat, I don't find to be good enough candidates to get the results I'd be happy with.
You actually turn people down because you don't want to take their money.
Yeah.
That's
Listen,
amazing.
I'd rather fail. I'd rather not have someone as a patient than fail to get results. So, but what we did is these people had no other alternative but to do surgery, and we opened up a laser division to help these people that, like you, with your shoulder. I may not be able to fix your shoulder, but
I think my shoulder's fine. I think honestly, I just need
to loosen it up.
Yeah.
We've got the highest dose, highest intensity laser to help get your motion back and reduce your pain.
Hey, Jerry wants to ask you a question real quick. Dr. Cogan on with us right now. What is it called again? Nerve
and Disc Institute.
What's up, Jerry?
How you doing?
Good. Say hi to Dr. Cogan.
Hi, Jerry.
Hey, Doc. Hey, how you doing, doctor?
Good. How are you?
Not bad. I've got degenerative discs in my back, and I've got a steel cage in my neck and my back, my lower back.
Ow.
I fell the other night and hit the floor pretty hard. I'm on my way to the hospital now because something's not right. I can't physically move right. I'm hurting somehow, some way, but. Where are you located at? Where can I get a hold of you at?
So we've got offices in Farmington, Clinton Township, Grand Blanc, and now Bad Axe. So after you have it evaluated at the hospital, feel free to give us a call. I was gonna tell Mojo we're gonna offer iHeart listeners for $49 a 2-day process of consultation, examination, review of any X-ray or MRI findings, and a free laser treatment included in that $49. For you, it's free.
Jerry.
You gotta go, Jerry. Seriously.
Yeah. I'm going to have to get the address from one of you guys.
Right.
You can send it to me or talk to me
I'm
after.
gonna have Lydia's going to give it to you off the air here right now, Jerry.
But still go to the hospital first. If you're not feeling right, get that checked
Jerry,
out, then call me.
You didn't get yours the same way I did. 5 glasses of bourbon?
I don't drink, but I had no.
Oh, there's a story, Jerry. We'll hear from you after.
We'll talk. Dr. Cogan, tell us what happened to Jerry. Actually, you can. It's HIPAA. But so, how do people make appointments? How do they get in?
Well, they can either go to our website, nervediscinstitute.com, or call 586-416-DISC. That's 586-416-3472.
Good thing about this being on a podcast, too, is you can rewind what you just heard.
So if I haven't fallen, right, I didn't get drunk or I didn't have a Jerry episode or anything like that, I may just not be as active as maybe I should be. My back is always hurting. Not like where I can't get out of bed, but like right now, I can feel tightness. I can feel tension. I feel myself having to stretch or turn almost like every 30 minutes. My neck, maybe. My
Or
neck.
fat.
Shannon, you want to throw it? Anybody else want to take a shot?
I think you look good.
All right, back to the business at hand. My neck hurts sometimes. I don't know if it's how I'm laying or my pillow's too thin, but is that enough for me to come in and see you, or do I need for something crazy to happen?
So most of the first of all, you would be a perfect patient for our laser portion of our office because it can help loosen all that stuff up.
Wow.
Most of the people that I see have severe or chronic problems. Their knees are bone on bone or their spine. They can have a severely degenerative bulging or herniated disc. They may have nerve pain. So I might be an overkill for you, but that's why we created this laser division.
But there's options.
It's good to start it
There's
now.
options.
Right? So
Yes, absolutely.
Do I get it free like Jerry?
Absolutely. Do I get out free on the air?
Absolutely. I'll set you up.
We'll do a trade.
Absolutely.
Hold on. Kara has a very important question. And what is that question, Kara?
Do you see children and do you see patients that have CIDP?
So the answer is children I don't see little children. So, if I see a lot of high school athletes that are juniors or seniors that are trying to become college athletes or pros, we don't see little kids. That's really not our thing. I have seen kids as young as 13 in certain instances. But there's a lot of pediatric places to see kids. But, listen, you can always give me a call. I will always call you back, anybody, and I'm happy to help people, direct them in the right direction if it's something we can't help them with.
Pain's the worst, and the worst is, and I don't want to go too dark, but people with a lot of pain sometimes turn towards the Motrins and which is not good to be
Slippery
taken.
slope.
But then it gets worse, right? And I feel like that's the thing. Like you spend all that money popping the pills, and you're not actually treating the problem, like you said. So again, Shannon.
Okay, so it's the Nerve Disc Institute, and you can find Dr. Cogan and all of his locations at nervediscinstitute.com. Probably the easiest way.
Ding.
Great to see you again.
Good to
really
see
good
you.
to see
Thanks
you.
for having
I'll see the laser people here. So what office is that out of? Or is it
all of them.
All of them.
Just let me know when you want to
Make
go.
an appointment for me in Bad Axe. I'm going to head up to Bad Axe.
Do I come to the same office he's coming to? Or?
Yeah.
You guys could come together.
Do you weigh us beforehand? Because I want to.
Oh my God.
Ways.
You're like two of me.
We'll be right back.